Welcome, future nurses. In this explainer, we're going to get you feeling confident and competent in one of the most common skills you'll ever perform, giving nasal medication. Getting this right is just so important, and we're going to break it all down so you feel totally ready for your clinicals.
So why are we focusing so much on this one thing? Well, get this. Medication administration can eat up a whopping 40% of a nurse's entire shift. That's huge. So mastering these skills isn't just a nice to have, it's really the foundation of being a safe, effective nurse.
Okay, you ready to do this? Let's dive in. We're going to walk through the whole process, starting with those universal safety checks, then the specific techniques for sprays versus drops, and all the way through to how to chart it correctly.
First things first, before you even think about picking up that medication, we have to build our foundation of safety. Think of these as the absolute non-negotiables you've got to do every single time, without fail. This is what protects your patient, and it protects you.
These first steps are your first line of defense. So 1, you check for allergies, super important to prevent a bad reaction. 2, you confirm the client's ID using 2 separate identifiers, right? Like their name and birthday. Got to make sure you have the right person. And 3, standard precautions. Gloves, PPE, you're protecting everyone from any potential infection.
All right, those first 3 checks are crucial. Now, let's build on that with what is truly the cornerstone of safe practice. Seriously, this is a mantra you will live and breathe for your entire nursing career, the rights of medication administration. First up, the right client. Just like we said, you're going to confirm this every single time with at least 2 unique identifiers. No shortcuts. Next is the right medication. This means you are meticulously, carefully checking the label against the order in the medication administration record, the MAR. Never, ever assume. Then you have to be sure it's the right dose. If there's any math involved, you absolutely must double-check it. This is such a common place for errors to happen, so be vigilant. Of course, you have to verify the right route. For what we're doing today, that means confirming the order is specifically for nasal administration. And you have to give it at the right time. A quick check of the MAR will tell you when the last dose was given and when the next one is due.
And finally, you commit to the right documentation. This happens immediately after you give the medication to make sure that client's record is perfectly accurate and up to date.
Okay, with all of our safety checks locked in, we're ready for the procedure itself. Let's get into the how-to and really focus on the 2 main types you're going to see out there, nasal sprays and nasal drops. Proper prep is everything. At the bedside, you'll glance at that MAR one last time, get all your supplies ready, give your client some privacy, wash your hands, and this part is so important. You educate your client. Tell them what the medication is for and what you're about to do. It builds so much trust and really helps with their anxiety.
Okay, now listen up, because this slide right here highlights the single most common point of confusion, head position. It's so easy to mix up. For a spray, the client's head is tilted slightly forward. Why? To keep the medicine from just running down their throat. But for drops, their head is tilted back so the medication can pool where it needs to be. Getting this right is absolutely crucial for the medicine to work.
So, for the spray, you're going to follow these 5 steps. Have them blow their nose to clear the way. Get that head positioned slightly forward, just like we talked about. Have them block the other nostril. Then you aim the tip toward the side of the nostril away from the middle to help it coat the nasal tissues. And finally, you squeeze the bottle just as they breathe in gently. Perfect.
And for the drops, the process is different but just as precise. Again, have them blow their nose first. Then they'll lie flat on their back, head tilted back. You hold the dropper about a ½ inch above the nostril. You don't want to touch it and contaminate it. And then you put in the right number of drops. And this last step is vital. They have to stay lying down for 5 minutes. This lets the medicine get absorbed instead of just being lost.
So the medication is in, but you're not done yet. Your responsibility doesn't end there. To really complete the skill safely and professionally, you've got to close the loop with good aftercare and charting. Let's cover those last essential steps.
Immediately after, your focus shifts to 2 things, effectiveness and safety. You'll tell the patient, hey, try not to blow your nose for a few minutes. Because if they do, well, there goes all that medicine you just carefully put in.
Then, before you leave, you do that final safety scan. Call light in reach, bed low and locked. Never ever leave a room without doing that. And then there's the documentation. This is completely non-negotiable. You'll chart the what, when, and how, but it's also so important to note how the client responded and what education you gave them. This creates a clear, legal record. And you all know the golden rule, right? If you didn't chart it, it didn't happen.
And this quote just says it all, doesn't it? It's the why behind every single step we just went over. Every check, every write, every little technique. It all comes down to one ultimate goal: protecting our patients from preventable harm.
Look, really internalizing this whole process is a direct investment in your success. You are going to be tested on this in your clinicals, you are absolutely going to see it on the NCLEX, and you will use it every single day in your practice. Hey, if you found this breakdown helpful, please do us a huge favor and hit that like button. And maybe share it with a classmate who could use it too. Make sure you subscribe so you don't miss our next nursing skills video, and be sure to check out the links in the description below for our summarized NCLEX revision books. They're a huge help for exams.
So, I'll leave you with a question to think about. As you move forward in your studies and into your career, what's the one common medication error that you are going to be most focused on preventing? Making one of these safety measures your own personal priority is a really powerful way to build a foundation for a safe and successful nursing practice. Thanks for watching.